Obviously, we're going to record this session because we had many people express their regrets in attending, and that's fine. We understand that it's a busy time of year, and we want to thank everyone for taking the time out of their busy schedules to join us for our part one of our clinical education lunch and learn. And there's going to be two parts to this. The first, today, we're going to introduce the competency-based education, and we're going to take you through our new curriculum and schedule, both academic and clinical placements, and also academic half days, which is part of that as well. Part two, which will take place on Tuesday, September 19th, and I have a slide on that coming up. We'll be talking specifically about the PEPA, which is the tool that we're going to be using for measuring student performance on clinical placement. We thought we would devote a whole session to that because there's a lot of change there as well. We are also going to be repeating both sessions again in October. So October 10th, we're going to be, during the lunch hour, we're going to be repeating this session, and the PEPA tool will be October 16th. So there'll be lots of opportunities if you aren't able to join us in full today. And then we're going to be posting a recorded session, either this one or the next one, on our website for your access to the slides and everything. So let's begin. I think it's no secret by now that everyone knows that our incoming class of 2023 are the first cohort to participate in our redesigned curriculum. Queen's has been at the forefront of implementing community-based education in our health sciences program, namely our medical program. And this aligns with the shift to more responsive and accountable training modules for healthcare professionals. There's been a lot of uptake in the literature on the efficacy of competency-based education. And to our knowledge, we are the first physiotherapy program in Canada to transition to this model of learning, possibly North America. So it's exciting. It's also a little scary. But I think overall we're pretty excited about what we've achieved, and it's been a lot of work. The curriculum for the competency base builds on essential competencies required to become physiotherapists. And so we've used and based it largely on the National Physiotherapy Entry to Practice Curriculum Guidelines. So we have a direct link to this document and reflected in our curriculum. Competency-based education organizes training around what we call milestones and competencies, rather than content areas of knowledge. Milestones serve as well-defined learning outcomes, and they exist on a continuum from a foundations level as students enter the program, and they build progressively as students reach entry to practice proficiency. Together, many milestones are related to a specific competency. And our redesigned curriculum provides students with an opportunity to be self-directed learners in their journey to becoming a physiotherapist. I'm sorry, I was remiss to say at the beginning, certainly as I go along the slides, if you have any questions, feel free to type it into the chat, or you can just interrupt, and that's okay, or you can save your question until the end. We'll have time at the end to go over any questions, but if there's something that you'd like to ask during the way, please do so, and I'll just ask Mel to kind of monitor the chat for me so we don't miss anything. Our curriculum has 7 domains: collaboration, management, communication, professionalism, humanism, and cultural humility, scholarship, leadership, and physiotherapy expertise. If we look at communication, one of the domains, communication comprises of several competencies, and each competency is made up of several milestones. If we look at the competency adapts communication approach to context, you'll see the milestones listed there that are related to this essential competency. So our curriculum is organized into 3 time periods, and each time period targets a set of milestones to ensure progression from a foundations level to a core, and finally to entry practice proficiency by the end of year 2. So rather than having courses that are solely based on knowledge, like we traditionally had before, like anatomy, gerontology, peds, or business, or anything else, students will be developing this knowledge within the broader courses through guided preparatory work and case studies. Students will revisit these foundational concepts throughout the program and apply them in new case contexts. Progression over time is enabled through what we call the spiral curriculum, which means that students will revisit essential competencies throughout the program. The spiral will introduce students to cases and contexts and then revisit them. Students will be exposed to different clinical conditions and they'll revisit them with increasing complexity over the 2-year period. They will revisit cases across the lifespan, from pediatrics, adults, and older adults, and revisit cases in various practice settings, such as acute care, rehabilitation, and community care and primary care. The spiral curriculum will help students progress from foundations of physiotherapy practice until they're ready to transition to entry-level physiotherapy practice. And it kind of looks like something like this over the course of the 3 divisions. It gets a little busy. So with respect to courses, we're going to be moving away from a systems-based course to 3 repeating courses that will use case studies, a flipped classroom, which means instead of having the instructor give a didactic session to the class, students are going to be grouped into small groups and have a team-based learning approach to the content. And of course, we're going to have the clinical skills lab there as well to develop competencies. The first of the 3 courses covers 4 physiotherapy competency domains: professionalism, collaboration, leadership and management, what we refer to as PCLM for short. In PCLM, learners will gain foundational knowledge and competencies related to the Canadian healthcare systems, leadership, interprofessional practice, individual practice management, professionalism, humanism, and cultural humility. Evidence-based practice and clinical reasoning, or EBPR for short. In this course, students will gain foundational competence in evidence-based client-centered assessment and management. These competencies will include seeking, appraising, and applying evidence using a clinical reasoning process that integrates evidence with client context and clinical experiences. Students will also develop communication competencies for clinical assessment and intervention. And finally, the third course is what we refer to as Applied Clinical Competencies, or ACC for short. And in this course, students will perform skills to demonstrate foundational competencies in evidence-based client-centered assessment and management. And these competencies will involve communication, clinical assessment, and intervention strategies, skills. The curriculum content is based almost on or presented, delivered in a weekly type fashion. And so this slide really lays out what a typical week will look like for students, whereby the Thursday, the week before, students will receive pre-readings and preparatory materials about the cases that they will be covering the week following. So for example, last week and orientation week, our incoming cohort on Thursday received this pre-readings, and today they've started on the content. And so the pre-readings, again, are quite facilitated, and it may include anatomy, physiology, definitions, prevalence, whatever the instructor wants to provide to help the students, to give them some foundational context prior to going into the week following, and will help them through the case development. The Monday, at the beginning of the week, in each of the three courses, the first 20 minutes of the course will involve a readiness check that the student will take individually. After the readiness check, the individual readiness check, the student will get into a small group and they will redo the readiness check in their small group, which will provide some discussion and collaboration, and they will re-answer those questions and submit that. The instructor of each of the respective courses will then take up the readiness check and clarify any material that was unclear, and then they'll continue on with their activity for the respective class. The Monday, Tuesday, and Wednesday will facilitate students through the cases where there'll be certain releases. For example, they'll have a release of the subjective information for the respective cases. Tuesday may be the release of the objective, and Wednesday may be talking about the developing a treatment plan for the respective cases. Thursday, there will be no classes because this will be the day that they'll be receiving the preparatory information for the week that's going to follow. And they'll also use Thursdays to help them prepare for this simulation activity on Friday morning, as well as a clinical competency assessment that will occur on Friday afternoon based on the week during the material in the week that they just had. And so the week following will look very similar, but with a different area of focus. And I'll take you through that shortly. I should have said to you, for any given week, students will have anywhere from 1 to 3 cases generally that they'll be working through, depending on content. So how does assessment work in a competency-based education? To assess if students are reaching the necessary milestones and progression towards competency, we will use frequent, low stakes, and meaningful assessments. So instead of having a larger exam at the end of a course to see if a student has met the competencies, students will be evaluated weekly through smaller assessments based on milestones. Evaluations will not only be done by the respective instructors, but also their peers and through self-evaluation to see how they're progressing over time. At Queen's, we'll also be using a custom design online system for students that many of you are already familiar with, and this is Elantra, which we're currently using in clinic to record and capture daily patient encounters. And this will allow instructors to track progress. And this will allow us to review student progress towards competencies and identify early if any difficulties, if any students are having any difficulties in meeting these milestones. And if they are, we're going to be building in opportunities for those students to catch up on milestones or help provide some extra resources for them to stay on track and meet their individual learning needs. In our new curriculum, competency-based education is operationalized in clinical placements through a concept we call entrustable professional activities, or EPAs for short. And this is going to be the topic of our session on Tuesday, September 19th. So I'm not going to dive into this right now, but we'll be talking about EPAs and specifically the Physiotherapy Entrustable Professional Activities Assessment, or PEPA for short, which is our new tool that we are using to measure student clinical performance while on placement. And so we're going to dedicate a whole session for the PEPA and EPAs, and we're also going to be repeating that session on October 16th as well if you can't make it on September 19th. But what I will talk about today is the timing of placements and how that looks, and I apologize for the busyness of this slide. We still have 5 clinical placements, and we still call them PT 881, 882, 883, 884, and 885. We have added in our new curriculum PT 886. However, it's not a clinical placement, but it is more of a project-based placement. And this is where students will develop plans for a community or population health intervention, such as a quality assurance and or quality improvement evaluation. And this 6th placement, if you will help us make it a little bit easier for us to achieve a certain a few competencies that is a little bit more difficult in our curriculum. And so we'll talk about placement of that. Timing, 881, the first placement will occur at the same point in the curriculum as it does now, our current curriculum. That will occur in January, February after the foundation's academic block. Students will return to campus in March and April for Core A. And then instead of going out in the summer for their second clinical placement, PT 882 will move up to May and June. And then students will come back in July and August for their third academic block, what we call Core B, which the students will then round out their year 1. When they come back in September, instead of coming back to an academic term like in the current curriculum, the new curriculum will have students doing 2 clinical placements back-to-back, PT 883 and 884. So 883 will occur in September and October, and 884 in November and December, respectively. And that will take them to the holiday break. They'll come back in January and February of their final year for an academic block. And then in March and April, half of the cohort will do PT 885 clinical placement, while the other half will do their project-based placement, PT 886. And in July and August, we'll switch the cohorts. So whoever done their 885 clinical placement will then do their project-based placement in July and August, and vice versa for the other. And so I think from this overview, you can see where students will have a more fulsome use of the 24-month program, and they'll be busier. We have a question: are the current year 2 students in this placement schedule? No, we're going to be having a transitional year, so the current 2 second-year students will be on the current curriculum as it was, not on the new curriculum. And so that does pose a little bit of an overlap for 2 placement sessions, which is PT 882 and 885. In other words, we're going to have, I think, 3 or 4 weeks overlap between the 2 cohorts. So we will be reaching out at some point soon to try to navigate that. And that's really the main sort of transition barrier that may be, or obstacle that may be a little bit more challenging for that one session. But the other thing I will say too is that placements are 7 weeks long in the new curriculum in an 8-week block. We always like the extra week for flex to accommodate holidays when if supervisors are going on holidays, or if there's any type of if they have a part-time schedule or whatnot. The contact time for students with the clinical supervisors, however, will not be 5 days a week. It will be 4.5 days a week. So a half a day a week, students will not be participating in placement. They will be removing them from placement, and they will be participating in something else called academic half days, which I'll talk about next. The students will still require in the 7-week block 210. That's the minimum hours that we need for clinical placement. So that remains unchanged. And the contact time with the supervisor will still be equivalent to 6 weeks. So that won't change either. However, because of these academic half days, it will lengthen the time in placement to 7 weeks. So what are academic half days? Academic half days are going to be regularly scheduled educational events that are under faculty supervision. So it's nothing that our clinical community have to organize or be a part of. They simply just won't have the student for that time, that half a day a week. And there are going to be two types of academic half days for students. One, for students that are close to campus, they'll be participating, they'll be coming to campus and help facilitating some of the academic components, like some clinical reasoning sessions and the clinical skills labs. This is something we've been doing, particularly with the clinical skills piece, on a volunteer basis for many years, and we've had such great uptake, almost too much uptake, that we can't accommodate it. We had to cap it. We're building this into the academic half days because of the value that we see on both accounts. The senior student who will be facilitating junior level students, which we've always found difficult to do ever since we've transitioned to a master's program. And also from the junior level opportunity to have the senior level students there with them. There's not a lot of opportunities for that collaboration. And so we're excited about this. Of course, this won't happen until the new cohort in their second year. So for those students that are not close to campus, who will be out throughout the community, will not go to placement during that half day. They'll likely stay at home or somewhere else, and they will join remotely for a virtual session that will be organized by one of the faculty members from Queen's, and they'll have organized events. Now, these academic half days, this is really based on feedback from students in the past that have said that they felt somewhat disconnected while they're on placement. And so this is an attempt to form a little bit more connection. And they'll also be have organized smaller groups where they can talk about, without identifying any patients, of course, but any patient encounters that they found challenging or successful, or anything that will facilitate learning while on placement. The last slides are really just outlining the content that occurs preceding each of the placements. And Mel, whether it's the current curriculum or the new curriculum, Mel and I often get these questions from clinicians when they're considering supervising a student. What has the student had up to this point? Which is a very great question. And although the slides are a little bit busy and maybe not a lot of content on them, It does provide some content of what has preceded for them going out, for example, with this slide, PT 881. And so this week, the students are starting with the ankle. And so you can see the list of conditions. I'm not going to really name them, but I will highlight in the new curriculum, there's a little less emphasis on just solely MSK, which is what we had in our current curriculum. We've implemented more cardiorespiratory and neurological conditions to help prepare students when they're in those areas of practice and settings, as well as is less of a private practice emphasis. So we're hoping that they'll be a little bit more prepared for placement for other areas than just MSK for PT 881. And prior to going out on PT 882 in May and June, these are a list of various conditions that they will be covering prior to 882. And again, 883, 884, and 885, which is a lot. So we're going to have this posted on our website for people to review. So we're not expecting anybody to learn these or memorize them, but they can always refer to these to give them a little bit more context prior to offering if it's helpful. And that's all I had at this point. I'm not sure if there's any questions that people would like to ask at this point. Anyone have any questions? Nothing? Okay, so just as a reminder, on Tuesday, September 19th, we're going to be going over the PEPA, and that will be on September 19th, and we're going to repeat the 2 sessions again. This session will be repeated on October 10th, part 1, talking about competency-based education and the curricular changes and academic half-days. And then October 16th, we'll also go over the PEPA again. So there'll be other opportunities that you can take advantage of.
Randy, there's a question here in the chat.
So are the academic half days, are they always the same time each week? Yes, they will be. And that's a great question. Thanks, Richard. I didn't talk about how this is going to be orchestrated on which timing. There will be 2 times during any given week that the student will be, each student that at facility will be having the academic half days. It'll either be Monday mornings or Friday afternoons. And we've had a community outreach prior to this a couple of months ago to ask our clinical partners, for those of you that joined us, what would be the best way to navigate this? And I think the consensus was at that time that we will just select those times. So for example, once we've matched a student with your offer, that offer will go out, or the confirmation will go back to you, and then we will choose one of those times. And certainly if that timing isn't conducive, or if you have too many conflicts, you can always let us know and we can reschedule it for the other time. But we just thought it would be a little bit easier to choose. And certainly if there's a lot of problems with the half day that you get selected for, then you can let us know and we can change that. Are there any changes that we should make in how we mentor the students? That's a really great question. I think I think the short answer to that is not really. I think when we talk about the PEPA assessment, I think that the main concept with community-based community-based education is that we're looking for much more frequent, lower stakes evaluations or feedback from others. So the comments that we've been getting from many clinicians is that they're kind of doing that anyway. And so I think the PEPA is designed along those lines where students will be getting feedback earlier rather than waiting at midterm and final. And so that is more in line with a competency-based education framework. So I don't know if you had anything else to add, Mel. Or...
I thought maybe I would just add one thing. We are trying to encourage the students to be more self-directed. So we're hoping like when they would come to placement and you might encourage them to be looking things up on their own, that they will have perhaps better skills with that. And we will encourage you to like, you know, have them look things up and be a little bit more self-directed because they'll be doing that in the classroom as well. So we'd love to hear your feedback on how that's working, but that would be potential other change.
Yeah, that's a great comment. And not to steal the thunder from our next presentation, but that's just it. The students will have a little bit more of an active role in soliciting the timing of the assessments during placement. And so it is a little bit more student driven, and they'll be more responsible for overseeing which competencies they've gotten and which ones they need to get. So yeah, Stephanie asked, with the old cohort placements, will clinical instructors need to complete the new and old assessment tools for placement evaluations? And we'll be covering that on the 19th, but the short answer is yes. For both the current curriculum and the new curriculum, we'll be using the ACP, the current tool that we've been using for final only. And the PEPA will be used throughout the placement. So the ACP is there as a safeguard until we fully validate our new tool, which is something that we're currently working on as we speak. So we've had a doctoral student that has been looking, and some of you may have been involved in his study looking at the usability and utility of the tool. And Mel and I are working with some folks from health sciences who are helping us navigate the validation of the tool, and that may take up to a year. So the ACP will be used for final only, not midterm, and the PEPA will be used throughout the placement as well. And we'll have more information on that in our next session, part 2. Any other questions? Okay, well, hearing none, thank you for taking the time to listen to this, and we will have a recorded session, but again, we'll be also delivering this on October 10th, but hopefully you'll be able to join us on September 19th for the PEPA and the information to follow with that. If not, we will be posting both of the sessions on our website after that time for your reference. So thank you, and enjoy the rest of your day. And we'll just remain online for those of you that had any questions.